Welcome to Parenthood Prep, the only show that helps sleep-deprived parents and overwhelmed parents-to-be to successfully navigate those all-important early years with their baby, toddler, and child. If you're ready to provide the best care for your newborn, manage those toddler tantrums, and grow with your child, you're in the right place. Now, here's your host, baby and parenting expert, Devin Clement.
Hello, and welcome back to the Parenthood Prep Podcast. Today we have another amazing interview that I'm so excited about. It is Dr. Danis Copenhaver. She is a pediatrician, and I love talking to pediatricians because there's so much I think that we can say about, the parents that are coming to them and the questions that they're asking and the things that they've seen, over their years doing the job. And she's actually particularly interesting because she works as a concierge pediatrician in New York City, which means she goes to patients' homes and actually takes care of them in home, which I think is just so great. And I love that that is something that is available to people because, as we all know, things can be a little chaotic at the doctor's office. Danis, hi. Thank you so much for joining us.
Hi. Thank you for having me, Devin. Really excited to be here.
Sorry, what's the name of your practice that you work with?
So I'm with Elliston Pediatrics. We're here in New York City. We've been around for 7 years. We were founded by Dr. Andrew Elliston and his wife, Heidi Meeker, 7 years ago. I'm the fourth doctor, and I joined in January 2025 to be able to expand all of our services from Manhattan into Brooklyn.
Oh, that's awesome. That's awesome. So what made you decide that you wanted to do this rather than working in office with patients?
Very good question. I think some of it is so I also didn't know this existed and was a really big surprise to me. So I am not originally from New York. I'm going to give a little background because I think it'll kind of frame what brought me into concierge medicine. I'm from small towns. I grew up in South Texas, Uvalde, Texas, which used to no one knew about, but now
I was going to say, I've heard that name.
Matthew McConaughey and then the school shooting. So very small town now with a little notoriety, but I grew up there till I was 11. And had this wonderful family doctor who took care of everybody. And he had like a Halloween party every year and the whole town went. And it was just a very tight-knit community and only one doctor pretty much that took care of everyone. And then moved to Arkansas, went to college in Arkansas, but always knew I wanted to be a doctor. Moved to New York and did all my medical training. And this crazy city sucked me in. And I fell in love with it. So did my med school at Cornell on the Upper East Side, did my residency at Columbia in Washington Heights. And I think through it all, pediatrics came pretty naturally to me. I've always taken care of kids. I've nannied, I've tutored, I've camp counseled, all the things. And I just love the people that are pediatricians. We all tend to be, I would say, a little softer, very smart, very committed, very dedicated, but we just have a little bit of understanding of what it means to take care of like these tender beings, which are children, and even teenagers are tender.
And really, it's not just the patient. You're also dealing with the whole parents and the whole family, which I mean, often with obviously someone in a medical situation, you are dealing with other like family members and things like that. But this particularly is
agreed.
Yeah.
Fully agree. Yeah.
A different
it's definitely
dynamic.
And I love communicating, and I love making sure that everyone feels like on the same page and feels good about it, and healthy families equals healthy kids. And so New York is not known for being primary care focused. I was like the only one that came out of residency that wasn't a subspecialist, and quickly joined practices in Brooklyn. I've been at small mom and pop practices. I've been at medium-sized family-owned practices. And then my more recent, and then I joined like a, venture capitalist funded group practice. I learned a lot in all the situations and just reinforced what I know, which is that medicine is not the economics of medicine is not patient-centered. And that just gets harder and harder.
Yeah. Yeah. We did an interview a little while ago with a OBGYN who I love, Dr. Nseo, and she was saying that, with a prenatal visit, you get 10 minutes. And with the postpartum follow-up visit, you get 20 minutes. That's wild. And there's so much you have to do in that time.
Yeah. You're set up to fail. That stinks. And it stinks. You're set up as the patient to not feel listened to and heard. You're set up as the doctor to not feel like you're providing excellent care. It's really, really tough. So, thinking that outward funding would fix things. And I was so proud of the amount of time we got to spend. And then, again, venture capitalists, I don't think have the patient centered either. Sorry out there, any of VC
So that
people.
was that was like a different model than like the
totally
health
different
insurance
model
kind of thing.
There was still health insurance involved, but there was like a membership model and a lot of money being injected into the company to kind of like be able to let patients have a little bit more time than when you're just volume driven. And even that just, I'm just going to say it failed in a spectacular way and I knew it, I could see it happening. So I started looking around and I looked for a full year. And at this point, I'm a decade into my career. I have had patients follow me from practice to practice. Sure. I know my patient population. I know my borough. I know that I'm good at this job. I know I love it. I love what I do. And then I was like, I just got to find where I can do this. And literally one night got really lucky. I was applying to hospitals and all sorts of things, just realizing like none of this, I can't go back to seeing 40 patients a day. And I saw this just like Danis Pediatrics looking to hire in Brooklyn, set up the interview, and it just felt right from the beginning. And the idea that I could take truly this small town model, almost go like back in time where you're going to someone's home, but in a modern context with all this really incredible, all the technology of the physical like hardware that we use in peds, which is, like the scales and the blood pressure cuffs and all that stuff, but also the software, the technology, all the things we can do on our phones and apps and communicate with our families was really exciting. It was the first time I felt like excited about a place to work in a really long time.
I love
and
that.
Really excited to be able to, I always felt like I really dug deep and had great relationships with my families, but it was at the expense of people being frustrated with me for spending too much time in rooms.
Yep. I could see that. I was a teacher working in the school system and I left that for a similar reason. I felt like my focus couldn't be on what I wanted it to be on, which was actually the kids and the families.
Yeah.
It had to be on paperwork and guidelines and like what this supervisor said today versus what this other supervisor said yesterday. And anyway.
Yeah.
The parents loved me. The administrators hated me.
Correct. But then like who gets to keep your job? It's really funny. So it's like when your heart's in the right place and your skill set's in the right place, but you got to figure out where that's going to be utilized the best. Yeah. So I met Heidi. I met Dr. Elliston. I met all the other admin and doctors, shadowed, got to like actually go into a couple of the appointments. I was like, oh, I can do this. I can take my shoes off and get on the floor with kids and do the appointments and see the toys that they play with and really get in it and be comfortable in this home situation. Because that is another thing. You really not only have to be comfortable in who you are as a physician, but just like showing up in someone's home and doing all this interesting stuff.
Well,
so,
and I was going to say, we work in home and just even seeing the home tells you so much about the people. Like, are these people, super neat and tidy and organized? And that's like really important to them. And are they going to want like facts and figures and strict guidelines for sleep training? Or are they kind of more loosey goosey and things are all over the place, like my house? And maybe they want a little bit more flexibility and flow and they like do better with that than strictness. So I could see as a doctor, just being able to see that environment being so huge.
Absolutely. And they're already at ease because you haven't had to like pack up the baby, schlep in the stuff, grab the kid from pre-daycare or whatever to like get them to the office. So there's already just a more ease.
And 10 times worse when they're sick.
Oh my gosh. Yes. And so like I'm the only one that's had to schlep in, which is fine because usually I have plenty of time because again, our schedules have been built to like make sure that we have plenty of time to do all of this.
This is what you're doing. You're out and about. You're going to these different appointments. It's fine.
And we've also had like communication constantly about what's been going on because the way that we're also set up is we have this like secure app where you can always be in contact with your specific provider. So we've already probably, by the time I'm coming over for a sick visit, I'm sure we've already been messaging for hours, if not days, like just with you telling me what's going on and then coming over. It's really nice. I think the kids still sometimes are like, doctor, what? Because we still obviously give vaccines because they are very important. And vaccines hurt a little bit and that gets kids nervous, but they do settle down when they can like have their siblings around distracting them or someone running a bubble machine or just things that you can't do at a doctor's
just
office.
Being home and not being in this environment where you've just had to sit in the
waiting room
and then in the exam room for however long. Oh my God. I remember seeing a post. People probably sent this to you. Some like little kid, the doctor came in finally to the exam room and the kid pointed to his watch and said, "This is a watch." And he wasn't necessarily being passive aggressive, but it was very like, and of course it's not the doctor's fault. You're doing, you're trying to cram in so much.
Yes. Sometimes it is our fault, but it's because like we're asked to do a lot of things.
Yeah.
I hated always feeling behind and that I was letting someone down. And now I feel like sometimes I feel behind in life because like who doesn't I've got 2 young kids and
but I feel like
it's all the things.
If I had a doctor coming to me, even if they were running late, like, I don't know, when you have like a service person coming or whatever, you're like, oh, it's fine. I'll just do something else. I'm just still home. Right. I'll just keep watching. I'll watch another episode of Gossip Girl. Like, it's fine.
I love. Yeah. Well, yes. Cause we still live in New York and we commute via public transit the vast majority of the time. So sometimes you're like, hi, I'm stuck on the 3. Like it's not going where I thought. So I'll be there in 10 minutes as soon as I can show up. But again, you're right. It's like me being 10 minutes late when you're in the comfort of your home and you know what's happening and we have communication is very different than I always felt so horrible when offices were like, we have a 10-minute grace and then they're cut off and they can't come back. I'm like, that stinks.
Yeah.
Because I know I have to see the other patients and also this family really needs to be seen. And like,
I also have to say, obviously the financials come into this so much because dealing with insurance companies and guidelines and stuff like that. Mm-hmm. I have had significantly better experiences taking my cats to the vet than taking myself to the doctor or going like to the pediatrician with clients. But of course, I'm paying an arm and a leg for that level of care. But like, sometimes I'm like, I am going to be 30 minutes late because my cat will not go into the carrier. And they're like, that's fine. Just, come whenever, like, whatever. Right. It's like, yeah, I can call them. We chat, like there's back and forth, like just in a way that I've not, fortunately, I have good care providers now, but there's been times in the past where it's just been like, yeah, like so different. And it's just because of the model. This is not a why healthcare in America sucks podcast, but aren't they all really?
Exactly. Well, and I think something that I really liked about Ellis is we do take insurance and it is all in network. There is just an additional like membership joining fee that then covers what allows us to see significantly fewer patients to come into your home for each doctor to have their whole setup. Like my doctor bag is a backpacking backpack, which I love. It really appeals to me who likes to pack, which is really fun. And then we also have this the thing that I like really sold me as a mom is that we have this very cool piece of technology called a TytoCare. And it is it's not we didn't create it. Obviously we like partnered with someone who creates it. And it is a piece of equipment that's a camera. So it can take pictures of throats and ears, like eardrums. And then it can record heart sounds and lung sounds and take temperatures. And then you can send all of that to us like virtually. So like you're upstate on vacation and you're like, oh, or middle of the night and you're like, and this makes me nervous. Like I want to listen.
Families have this.
Yeah. It's part of the membership is that you have this.
That is amazing. And
it's really cool in concert. So it actually makes virtual visits so much more useful. It gives you peace of mind when you travel. And I also love that. There are times when I would like check an ear in an office and be like, I don't want to treat those antibiotics. It doesn't look that bad, but I don't know if I'm watching it get better or get worse. And I'm like, I need you to come in tomorrow. And parents are like, for real? Yeah. I have to take a time. And now I can say, I can come back. Or if you would just like to take a picture of their ear in the morning and send it to me, we can just monitor it. So it like reduces antibiotic use. It reassures. It's so cool.
Yeah. That's super cool. That's the kind of technology that I feel like is actually useful and not some of the stuff we like sometimes on a virtual visit. Like I get strep sometimes and multiple doctors have been like, adults don't get strep. And then they show me the test and they're like, well, except you. And I'm just like, I wish that we could do this virtually. Like I'm sick. I'm miserable. I know I have strep. Like, why can't I just tell you like, or why can't you get, and I just didn't end up ordering test kits or whatever, but like, talking to you virtually is not going to help, but having some way to like
taking the pictures,
give you the information.
Do all that stuff.
Yeah.
Yeah, it really does help because we can do all of that. And then I can say like, this really looks like X, Y, or Z, or nope, that really looks like strep, but let me come by and swab you and send a culture because 10 days of antibiotics when you're an adult is a pain. It's so painful to give a child 10 days of antibiotics. And I'm like, if it is not strep and if we can avoid that, excellent.
Yeah. So that's amazing. I love that. As you were talking about your like family doctor growing up, I thought if we had that, we were in a, medium-sized suburban town in New Jersey, but the doctor that we ended up going, she was amazing. She was our pediatrician, but she was like also my parents' doctor. I had my first like gynecological appointment with her. Like she did everything. And it was amazing. Like this doctor that you already feel comfortable with, like growing up with you. And now she primarily focuses on like older people, I guess, because a lot of her patient population got older, but
probably just aged into it. Yeah.
Yeah. So eventually she like cut out pediatrics and stuff like that. But it was just so great. It was like, oh, what's wrong? Call Dr. Z. What, any issue you had, any problem, it was like, just call her. And she was really, took the time and was very
and knew your whole family.
Exactly.
That's what's so lovely. And even though we can't I can't medically treat a parent because they're not technically my patients, but like one person gets sick, the whole family gets sick. We can talk to you about how to keep the whole family healthy, mental health. You have a baby, you've got postpartum, we can actually spend the time to talk to both the mom and the dad or both parents, whichever, and say, how's everybody doing? Who needs help? I can help so much more because I have time to check in. We have resources. We have an admin who can get you in to somebody if we need appointments that are hard to get into.
Awesome.
For all sorts of things. Me too.
And that's something that, again, I was talking to Dr. Nseo about because I've always thought it was so bizarre that you are with your obstetrician weekly throughout your pregnancy. Then the baby comes out, they say goodbye, and that's it for 6 weeks. And then if it's your second baby, you already have a relationship with the pediatrician, maybe it's a different story, but then you're shifted to the pediatrician and then you're there every week or multiple times a week with your newborn doing weight checks and all this different stuff. But you don't know this doctor. You don't have a relationship with this person. So what would you say is the role of the pediatrician with the newborn, the new parent? And what do you try to do to make them be aware of what might be going on with them as well, even though they're not your patient technically?
Well, I mean, I do a lot of talking. It's a lot of, and listening. I think it's both. So luckily, if a newborn is doing well and thriving, that actual newborn visit, actually examining the newborn takes 10 minutes. It could be an in and out if no one said any words.
Yeah.
And when I was in the office, I would just hold the newborn and say, tell me your things. Just talk to me. Because newborns are little aliens and very few of us grow up seeing a newborn. Even if you're around kids,
100%.
Newborns, those first 3 months that you're really with the parent, they are aliens. They do weird stuff. You don't even see them on
TV.
No. When babies being born, I annoy everyone I watch TV with. I'm like, that's a 4-month-old.
Oh, same, all the time. I'm like, this is the most ridiculous thing I've ever seen. There was that show, Sons of Anarchy, about the motorcycle, and the baby was supposed to be a little preemie, and in the incubator they had, I guess, a doll or a model. But then when he was holding the baby, I was like, that is not a 27-week preemie. That baby is 3 months old. He's ready to leave the hospital. Take him home.
Yeah. I sort of love when they do get a baby that does look freshy. And I'm like, ooh, that must be a crew member's baby. That was someone knew a newborn to bring that baby in because that one actually looks kind of fresh.
I've actually heard that the reason that they can't get teeny tiny newborns is not because of lack of availability, because there's a lot of parents in Hollywood who would put their baby on television the day it's born, but because you actually need a work permit and you can't get one until you're born. So the newborns that have work permits are few and far between. Isn't that insane?
That is insane. But that actually does make sense because I have signed a lot of child performer work permits. So I can see
interesting.
How odd it would be if at a newborn visit, they're usually toddlers or something baby models at 6 months. I have not signed one for under 6 months before. Yep. I'm sure there's more involved than just the health sign off I do. That's funny.
Isn't that funny? I heard that and I was like, you know what? That actually does make sense. I could see that. I could see people being that.
That we have some child labor laws, right?
Yeah. for now. So, okay. So what were we talking about?
Newborns.
Talking to the parents with a brand new newborn.
Yeah. So I like to just hear where they're at. Some feel like I got this and they have like a sense about them, or like second or third time parents that just kind of know it a little bit more. And then you're like, you got this. I see that you got this. Let's just remember, let's talk about like feeding schedules, peeing, pooping, safe sleeping, all of that. And other times you can hear, even if some people will say it, I am terrified. I can't believe they let me go home with this baby. Yep. And others are saying it with all of their other ways other than their voice, that they need a lot of reassurance. And I love, and I think any doctor with good bedside manner, peds or otherwise, walks in and can get the energy, like understand what's going on in the space that they're in, and hopefully, again, good bedside manner, respond to it, like flip the energy that you need. Like, I know when I need to be high energy and the clown and happy with the kid, and I know when I need to be like calm, like in charge energy, whatever is needed. And I listen to what the parents are telling me, and then I reassure and I try to validate and encourage and praise everything that they're doing right. And then if there needs to be not tweaks, but like you're doing all of this amazing, and we can like let some of that go, whether it's the guilt or the number crunching or things like that, if we're able to. And sometimes we're not, because we're trying to get a baby to get a little bit bigger. And so I'm like, I know it's really tough. It's not forever. It's not sustainable. You are correct. But we're going to have an off ramp to this, but this is just what we have to do right now. So I just do my best to explain. And then the talking part is then I try to tell all the weird stuff babies do. Oh, and they won't be able to hear all of it. So many weird stuff. But I try to, my line is always like, you're going to see me so often. I'm going to give you, and trying to give you all the information is like drinking from a fire hose. So I'm going to give you the information you need to get to the next time the plan is to see me. So in the beginning, it's like a week or 2 weeks. And that doesn't seem like a long time, but it seems like forever. So I'm going to give you as much as I expect to hear. And then it gets a little bit bigger. So I try to give as much anticipatory guidance. And when in a traditional practice, sometimes that's the only communication you could get with me, because just there was always like, patient portals and things like that, but that just gets kind of hard. But now I can have like real time, almost like texting with patients. So they're like, they're making a weird noise. And I'm like, yes, they are. Remember?
Yeah.
Normal.
We talked about
weird.
That. Yes.
Exactly.
Yes. Yeah. We do that a lot too. Like we say, obviously we're not medical care providers, but we are experts in the normal. So that's normal. That's fine. I know that seems weird, but it's normal. Nope. That's unusual. We want to call the pediatrician about that. Like, but we're not, rushing the baby in for every little thing that is definitely just a normal weird thing that babies do. Which is, you're right. They're so weird. I actually did a whole episode about like what to expect from a newborn, because they are weird little aliens that you've probably never seen before. Even if you've seen like a 6-week-old, you haven't seen a brand new newborn. Like it's different.
The freshies and the 1-month-olds, I always like to say that like at 1 month, if you were doing anything else 24 hours a day for a month, you'd be an expert almost. But not having a baby. At a month, you're in the weeds, because there's a different kid and you're like so sleep deprived.
Totally.
And the adrenaline's worn off and they're just still figuring out how to be in their body. And at a month, they're real irritated about it.
Well, and they say all the time that every time you get used to something, you're getting a routine, like it changes. Or it's different. Even I think when people have had multiple kids, like maybe by the 4th one, you remember the newborn stage, but the newborn stage is so specific that you have that second one even 2 or 3 years later. And you're like, wait, what? I don't remember any of this. So that's why having people that see newborns all the time is like really, really helpful, because we know. And then sometimes the grandmas will be like, oh, but you were like doing this or that at this age. I'm like, they weren't. There's
no way
like
that
you don't remember.
Right.
There's no way.
Like, especially with first time moms, I'm like, I didn't remember from my first to second. There's no way that your grandmother remembers from like 30 years ago or whatever it was.
Totally.
It's just impossible.
Yeah. Yeah. So that's great. And then if you feel like there's any signs of possible issues or things like that, you would just, send them to.
And there's some specialists if we have to. Yeah. Sometimes at the beginning, it's just like, actually, I'm going to come back in 2 days and let's just see what this kid is
No, I'm sorry. I meant like with the parents, like you would refer them to a therapist or tell them like to talk to their doctor or something like that.
Yes.
any
right. Yes.
postpartum mental health issues, that kind of thing. No, I did not make it clear what I meant.
That's fine. And I also just like screamed into the microphone. Yes, absolutely. So we have a great list of like mental health providers for both like the birthing and the non-birthing parent. And we can help get you in with that. There's a lot of really good support groups. I think sometimes one-on-one therapy helps a lot. Sometimes just validating helps a lot, and talking to your pediatrician, especially with the anxiety around the kiddo, depending on how it's manifesting. And then other times, and this is harder, this is trickier, and maybe a little bit where you guys come into, but sometimes it's just really, you got to find your mom group and like the other women or parents that you connect with that have babies your age, because you're right. A 6-week-old is totally different. And sometimes you just need someone you can text at 4 a.m. that's like, are you going a little cuckoo banana pants?
Yeah.
Me too. Let's meet up for a beverage tomorrow at some point.
Yeah. And people I think that are, obviously you're not going to be totally aligned with anyone on your thoughts and ideas and things like that, but having people that are at least somewhat like-minded in the way that they're doing things, like the people in your due date group might not be, or only certain people might branch off. Early on, when I first started the business, a bunch of girls I had like grown up with were having babies, and they added me to their like mom group on Facebook. There was like the heyday of Facebook, which I miss. Mm-hmm. Oh my God, Facebook groups are so great. But all these girls that I'd gone to high school with that I hardly knew, now we're all in this like group together, and I'm giving advice and I'm talking to them about sleep and different things. And it was just so lovely to see how they were all supporting each other. And even ones like, it was a pretty big group. So there were certain ones that were a little more like on the natural side. And I hate to call it that, but like a little bit more on the like schedule side versus the on-demand side and that kind of thing. And they like kind of all found each other. And like, it was just really, and everyone was just really, really supportive. And it was rare that there were arguments or fights. And when there were, the people would, intervene. And it was just so nice. And I think it was such a great support system. These girls have teenagers now, which is crazy.
Wow.
And my business baby is a teenager, so I guess it makes sense. But oh my gosh,
that's amazing.
They just,
it goes by fast.
It does. It doesn't feel like in the moment, but it certainly does.
It's that line, it's the longest, shortest time.
Yes, exactly. I heard a client say once, this is the hardest job I've ever done on the least sleep I've ever had.
Oh, wow.
And it's so true. And I think that you can't bring the energy that you've brought to other areas of your life to parenting. And that makes it so difficult. Like, you've gotten through college, maybe grad school, law school, medical school, and then you have this baby. I thought I was going to have
this.
Oh yeah.
I was already a pediatrician. I did 24-hour shifts in the neonatal ICU. I'd been in the PICU. I was like, I'm going to have a baby. I'm a pediatrician. I know it's going to be hard, but it's going to be fine. That little boy, came early. So I got to be a NICU mom, which was its own adventure.
Oh, being on the other side of it too, being familiar with it from the other side.
Yeah, exactly. And then he came home, and I just remember like holding him, staring at it in his face and thinking, why do people keep having kids? This is the worst. Like, I am so tired. And like, he's just, he makes no sense. Like, my brain, you want to find those patterns. And I was just like, oh, this is different. You can't leave this behind. Even if you do a 24-hour shift, you get to go home and go to sleep for a little bit. This is just your whole life. And then I had another one. It never gets easier. You adjust, I guess, a little bit to the like lack of sleep. But it is wild. I love, the only thing I love more than being a doctor is being a mom. Both have their own challenges.
Sure.
But it's such a privilege. And it's such a, like, obviously it's a little, I don't want to say it's easier to be a mom, but it's different.
It's different.
You don't have to go in as much debt maybe sometimes.
Yeah. Right.
Even though raising children is very expensive.
Although it doesn't pay you any income. So I guess that's kind of the trade-off.
Just take it away from you. Yeah, lifetime. You're right. Oh, geez. They're both incredibly expensive. But it's such a privilege to know someone their whole life. And like, as a parent, you get to have that, however long that life is, you get to be there, and then you get to be with them their whole life and have an intimacy with these little humans that you know their body, you know their brains, if you're lucky, you know their souls, and you just like get to, and being a pediatrician reminds me of that too. And I think that is also why being a pediatrician really appeals to me, and being in that home even adds to that intimacy of like, oh, like, you trust me. to enter your home, to take care of your kid, to like touch their body, to tell me your fears, to let your kids be, it's such a privilege that I don't take lightly to be asked to be into your family like that, into your village. And I love it. Even when I'm exhausted, I love it. I think that parents feel that. I think anytime you've been with a healthcare provider or a doula or a nurse or someone who comes into your home and takes the time to see you and hear you and help you.
Yeah.
You're just like, oh, thank God.
People are sometimes
held a little.
Yeah. People are sometimes hesitant about like hiring us. Like we'll talk to them before the baby comes and they're like, well, we just don't know how much support we're going to need or how we're going to feel about having somebody in our house or whatever. I'm like, I understand that, but you're going to feel great. And they like always do. They're, oh my God, I'm so happy you're here. Like they're like, oh, can we trust this person and blah, blah, blah. And I'm like, yeah, you can check on us as much as you want. We can, whatever you want to do, we can do. And then within like 3 nights, they're like, see you. Bye. Like, I trust you. I'll see you in the morning. Yeah.
And they're sharing their like deep stuff with you.
Yes.
And you're like,
yes.
Great. Like, let's hear this so I know how to like support you through it. I'm also very, especially for like well visits too, but sick visits, or sometimes you're like, you probably get this too, I'm sure. And you're like, what are you saying? Like, I want you to say out loud the thing that is keeping you up at night. What are you really worried about? Even if you think it's irrational, I'm not going to judge you. Like, let's say it out loud and then I can tell you why I am not worried about this. Or it's like the last thing on the list of the thing that I'm thinking about. Or maybe it's like second to third. I want you to know I'm thinking about it too. Because in addition to feeling privileged of taking care of your kid, I also have like a intense scientific and medical training that I am like constantly triaging in my head to make sure like while I'm making goo-goo eyes at your baby and smiling and singing a song to them, I'm also noticing like every reflex and eye tracking and all the different things to make sure that like neurologically that baby is doing everything I expect it to do, all hopefully while looking to everybody else that it's just like a charming little interaction.
Yeah. Well, and I find, and this is something that I've been wanting to talk about, so I think it's the perfect segue. A lot of the time, the stuff that the parents are worried about versus not worried about are like not the things that I'm thinking about, like at all, or the things that I'm concerned about, or the things that potentially are going to become issues down the road, or things like that. Like I did a whole episode about it, safety things that I think people freak out about, these like weird safety things that are not a concern at all. And then have like cords next to the crib that I'm like, this is a huge issue. Like, and they're just like, oh, what? It is? Like, so people, a lot of times the thing you're worried about is not the right thing to be worried about, or not the right thing to be focused on, or it's fine and you don't have to think about it or worry about it, but you don't really know that. A big one for me is choking. Do you feel like parents are like appropriately worried about choking? Because I don't.
No. I mean, it's like, well, things come in ebb and flow. And I think the internet, blessing and a curse. So if there's like a news story recently or a TikTok or something that came up, then there'll be like a blip and people being concerned about it. Okay. But I will get so many more questions about like the best first vegetable to feed a kiddo, or like how to start things. And I'm like, all of that's going to work out fine. Like, honestly, the more calm you are about it, and let's just the variety of foods, lots of flavors, let's do it. Even allergens. So worried about their kids having an allergy. Yeah. Which, even though there's a rising incidence, pretty low risk and like good to start early, start at home.
And that's really changed. I remember
so different.
15 years ago when I was a nanny, we were holding back on certain foods until X point. And now they're like, give them everything, expose them early, like.
And that's science. Like that's
bring peanut butter to the hospital and spit. Not really, but.
No, but it does feel like that a little bit. No, it is because the research really showed us that doctors, we were doing the wrong thing, that we were making it worse, and that the science behind it is like, actually, let's do it early and introduce it through the mouth so that the body knows like this is food, not something to fight. But then I'm like, oh yeah, don't let them put balloons in their mouths. Like they don't know how to exhale. They'll inhaled. Oh, I'm like, no popcorn till 4. And like, really? I'm like, that stuff is airborne. And then, and like more kids need to be bronched. I mean, even if they don't choke where they go blue, it goes into their lungs and causes infections and things. Whole nuts. I mean, I can't tell you how many kids at 2 are coming in and they're getting fed like whole almonds for snacks. And I'm like, they don't have molars. They're not chewing and grinding. They're little snakes. They're like, and they swallow it whole.
That's such a good example.
I call all little kids little snakes.
Little
snakes.
Like,
rip and tear, but then they just swallow it. They don't actually learn to grind till they're 4.
Oh, wow. Yeah. I mean, that makes sense. I had a 2-year-old I was sleep training, like 2.5. She was very precocious. She was very bright, but she was very tiny. And they were worried about her like weight gain. So they were actually like feeding her in the night when she was waking up. And I'm like, okay, she's 2. I know you can't see her face, but I can. And I was like, well, what if we put some kind of like little thing that she could just manage herself? Like, you know, whatever. We were like brainstorming some ideas for maybe something that she could get by herself in the night. And the mom was like, oh, what about nuts? I was like, are you kidding me? No, we are not doing that. Like,
right. Well, cause I think we often think of, well, we have a disconnect, but like, we're like, oh, children are small adults. Nuts are healthy. And you're like, but they're not.
Yeah.
They don't, which is another way that people, I think, then get worried about certain things that kiddos have because they're projecting our adult stuff onto these kids. So either expecting them to be able to do a higher skill level that's maybe not happening yet. Like how late a kid walks when they're 12 months and not taking a step. I'm like, we're great.
Yeah.
That's fine. Like, let's give them time. Or, I mean, there's so many, but like, but the choking thing again, they're like, oh, this is healthy. This is something I would snack on. This is like popcorn or nuts or whole nuts or things like that. Hot dogs. So fun. So summer. Let's give them a hot dog. They're 3. And you're like, they're still not. That is a throat shaped object that is just like they take a gulp because they're excited and they gasp.
Little snakes.
In their esophagus. Yeah. And then everything's stressy.
Yeah. I mean, grapes, berries, like whenever I see a kid with like whole blueberries, I'm like, no, like smush them, like pre-chew.
My favorite.
Alicia Silverstone, pre-chew the food and spit it into their mouth. Not really, but something.
Some things, if in a pinch, fine.
Yeah,
if you can't pinch it, bite it. My favorite Mother's Day gift, and I got mocked viciously by my partner at the time because I wanted one of those cutters, like a grape cutter, tomato cutter. And it's like just a one-use tool, and it seems like totally wasteful.
But you use it constantly.
So handy when you have a kid. So lovely.
Yes. I was just going to say my sister, when she was a teenager, she had these like super intense braces. She had all this stuff going on in her mouth. She had surgery. She just had all this crazy stuff. And once in a while, she would like choose to eat something that was not going to work with her like mouth situation. So I would literally like take a bite out of an apple and hand it to her. Like, you know, not like chew it or anything, but just like, let me just break this off with my teeth and give it to you since you can't do that with what you have going on. Or she bought like a frozen candy bar. I was like, what did you think you were going to do with this? So I just like bite it and, I know it sounds gross, but like I said, it wasn't chewing it up. I was just like, my teeth work and yours don't. So let me give you these little bites for you. Like,
it's so instinctual to do that for people.
Yeah.
Like, and you want to share that. I think food is also, that gets us all really stressed too, because it's like how we share, like, how we make our kids grow. So we're always worried, kids aren't growing.
Yeah.
They're almost always growing. It's how we share community and culture and all sorts of things. But it is very instinctual to like bite. Like I'll bite a little piece of carrot off and hand it to my kid. I can't tell you how many times I've just been like,
teeth are so effective when we don't have grape cutters in our pocket.
Yeah.
I wouldn't do it with just like any random kid, but like when I was a full-time nanny, like I bite half the grape and I give you the other half. Like I eat the half and you eat the half. Like it's just normal it just feels very natural to do that. You're right.
To be sure you never miss an episode, be sure to subscribe in your favorite podcast app. We'd also love to connect with you on social media. You can find us on Instagram at happyfamilyafter or at our website, happyfamilyafter.com. On our website, you can also leave us a voicemail with any questions or thoughts you might have, and you can roast your baby. Talk to you soon.
Thanks for listening to this week's episode of Parenthood Prep. If you want to learn more about the services Devin offers, as well as access her free monthly newborn care webinars, head on over to www.happyfamilyafter.com.